I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
For today's meditation, I selected a reading that's a little bit uplifting. We're in a little bit of a depressing time now, but I want this to serve as a reminder. It's inspired by 1 Colossians verse 16. Through his power all things were made, things in heaven and on earth, things seen and unseen. With one decision history began, existence became measurable. Out of nothing came light, out of light came day, then came sky and earth. And on this earth a mighty hand went to work. Canyons carved, oceans dug, mountains erupted out of flat land. Stars were flung and a universe sparkled. Today you will encounter God's creation. When you see the beauty around you, let each detail remind you to lift your head in praise. Express your appreciation for God's creation. Encourage others to see the beauty in it. Heavenly Father, as we confront this epidemic, please guide our decisions here on earth. We thank our nurses who are celebrating Nurses Week on the front lines of this epidemic. Protect all first responders, cure all who are ill, and please protect the vulnerable. Let our work here be your work. We ask this through your Son, Jesus. Amen.
Amen.
All right, gentlemen, since the bulk of our work today is as Board of Health, we need to recess County Commission and move into the Board of.
So moved.
Second.
All in favor, signify by saying aye.
Aye.
Aye, and motion has carried. We changed the format for those in the public a little bit. I am Dwayne Reese, the chairman. On our public comment, instead of going to Facebook, you were encouraged to put those questions, observations, comments directly to our clerk. And we have a couple here that have come in ahead of time, so I'm going to put Dory on the spot and have her read those comments to us, and we will briefly respond to each one as she finishes. Thank you, Dory.
You're welcome. The first comes from Beth Coxall. Good morning, Commissioners. I just wanted to thank you for finding a way to host these meetings virtually. I would like to see the recording and sharing of these meetings continue after stay-at-home orders have been lifted. Having meetings recorded is a great way to engage more people in our local government.
Comments, gentlemen?
Dr. Clifford here. I think the public certainly embraced this type of access to our discussion and decisions. So I certainly would appreciate what the staff has done. We put this online, and I do agree we should continue.
Okay, thank you, Doc. Seeing no further, next one, please, Dory.
The second is from Julie Christner. Good morning, this is Julie Christner, and I'm the manager of Key Office Products here in Garden City. I'm so glad that I am not responsible for making the decisions all of you must make. I listen to and see the comments that this community is making, and I watch the news daily. As a manager, business cannot continue to remain closed or partly closed. Even businesses fully open as we are feeling the pain of our customers being closed and or partly closed as our business does not function correctly or profitably during this time. This pandemic is creating a business financial crisis that I am not sure we as a community will recover from fully. At the same time, we have a pandemic from a virus that causes anywhere from no symptoms to death. While we know that older individuals and those with medical conditions are more at risk, that does not always play in the morbidity of the disease. And unlike the flu, this virus can last 2 to 6 weeks before full recovery. And I see that there are now 64 children in the hospital in New York from a strange Kawasaki-like disease that cannot be ruled out as coming from COVID-19. Thinking that months into this, the very age range we thought was safe could now be suffering from a form of this disease is frightening. Not only that, but increased heart failure, kidney failure, embolisms, and lung damage from those that contract the disease are being found as having these lasting problems from recovery of the virus itself. The thing is, we cannot with certainty predict who will suffer the most or die from this disease. We also cannot, under any circumstances, remain locked down until there is a vaccine. So what do we do? As a provider of PPE, it is near impossible to find the necessary hand sanitizing face and hand products to open up fully. These products are on order and pending, but the healthcare system has been deemed a priority, so until those demands slow, we may find necessary healthcare items hard to find. Thermometers are even on back order right now. My biggest fear, and we are not a restaurant, is when legislation will be passed that says a business cannot be sued for a customer catching COVID or saying they have caught COVID from a business. That must be settled, must be. I am not a legislator, so I ask, can that be addressed locally? If I can't provide a mask or hand sanitizer to the public, am I liable? Are we liable if my employees are not wearing a mask? If the virus and subsequent lockdown doesn't doom a business, litigation even once could. As I said, our business is deemed essential, and we are at 50% in the office and have been. Those who can work from home, including myself. We will welcome opening up, but we will do whatever is deemed necessary, as I have no answers. Our business will most likely survive for some time, even with a long lockdown, but I know not all will. However, I am very interested in finding out what a business's liability will be, or if there will be protections against lawsuits. We will be open for the public, but if our community is open, our businesses cannot take the responsibility of the spread of the virus. Thank you for your dedication to this community.
Julie has covered quite a range, guys. A lot of comments, appreciate those, some questions. As far as the legal aspect, that is a really good question. I have no answer to that, and I don't know if our county attorney would like to weigh in on that. As far as the county council, excuse me, I've been corrected. She's not on, I did not believe. But anyway, anybody from the medical care to talk about the issues of finding necessary products, PPE? Any comment from anybody?
We struggle daily for PPE from an emergency management perspective. We're in constant communication with our state emergency management, and they are disseminating as they get it. The feds have come through and sent some through the state, and it's slowly working its way out into the field. So there is some opportunity out there, and we encourage people to contact us at emergency management, and we do what we can to support that initiative.
For those who could not hear, I'll summarize what Mr. Green said, that the first responders are naturally, as she mentioned, getting the supplies they need. If you absolutely cannot, you may contact emergency management, and if he can, he will help you. But as Ms. Christner mentioned, it is going to those on the front line right at this moment. Comment?
Mr. Chairman, this is Lon, and the one comment I would make is back to your reference to the liability issue. There's going to be lawsuits. The headline I saw just a couple of days ago is lawsuits are in the pipeline, and it won't be a concern just from what Julie's perspective is in the business, and I do respect what she's asking, and I think some of that's a legislative issue. And certainly that's a concern of businesses, I get that. But there's going to be lawsuits from other aspects too. People who have been locked out, people who have had their freedoms taken away from them. So the lawsuit thing is concerning to me. And like I said, the headline the other day is lawsuits are already in the pipeline.
Let's move on. Next one, please.
This one comes from Tyler Courtney. With our numbers continuing to rise by moderate to large quantities daily, I feel it would be wise to extend our shelter in place for at least 2 to 4 weeks, or until our numbers start to decline. Thank you.
Comments from Mr. Fortney?
Well, we'll be interested to see what the actual numbers are here this morning, so we'll wait to comment.
That is true, that is why we're here today. Next one, please.
Right, the final comes from Jill Wessels. Good morning. Consistently throughout the week, there has been a large discrepancy of cases reported on the Finney County website and the KDHE website. For example, on 5/6, FICO reports 740, while KDHE reports 532, and again on 5/7, FICO reports 770, while KDHE reports 589. From watching meeting proceedings, it seems that Finney County officials and KDHE have been in direct communication and monitoring the situation very closely. Is there a way to streamline reporting so that residents can get consistent, accurate picture of what is happening? Up to this week, those two agencies had numbers that matched, or if not exactly, were off by a few. What has changed? With so much information out there and having to sift through and decide what is true and what is not, residents of FICO should be able to trust the information coming out of these two agencies. Residents want a current recovery rate. Throughout the pandemic, other counties in Kansas have been publishing recovery rates, which I believe to be an important part of the total pandemic picture. After testing positive, what kind of follow-up is being done with these families? My concern is that if an entire family tests positive and should be quarantined, how are they obtaining groceries to feed their family? I'm afraid that many of these families are without an extended support system that can help them during this time, and this would make it necessary for them to venture out to obtain food and supplies to care for their families, which puts us at risk for further spread of the virus. Thank you.
I might attempt to answer the first paragraph with the discrepancies. These numbers change so fast, so rapidly daily, that while the numbers are accurate, sometimes there's a timeline lag between everything getting jived to match up. That's the best excuse I can come up with, the reason I could come up with. The numbers are so great right now that the time lag doesn't always coincide.
So if I may explain a little bit more to that. So the state system, we used to send all of the rapid testing to the state and they would enter it in. We're now pulling that data entry in on our side. And because our numbers have greatly increased, we're about 3 to 4 days on that manual entry in because we've had so many results to put in the system. And so you're seeing a large difference between what KDHE is reporting because we still have a huge pile to continue to update. And so there's going to be an additional lag between what we're recording versus what the state is then reporting off of their side.
Do I need to repeat that for the audience, or?
She's near the microphone.
There's going to be an additional lag between what we're reporting.
Okay, real briefly, Colleen stated that their system, their information is entered into the Finney County database immediately, but that information is not necessarily transferred to the state on that timely of a fashion. There's a little bit of a time lag. That is the reason for the difference. Am I close, Colleen? She's nodding that I sort of got it right. She asked a couple other points. Anybody want to, I think the commission as well would like to see the current recovery rate. I think that does help our decisions with the data. So I think you have a very good point there. The final paragraph, after testing positive, what kind of follow-up is done with these families? Robert, would you mind taking that one? Or?
Follow up on with the families?
Yes.
Is that what actually Colleen would?
Colleen, could you
would
find
be
my
much
Colleen so I don't
better
have to
to
translate?
do that.
Thank you very much.
Well, so with the follow-up of the families, when the families come through and get tested, we do give them an education packet. There is information with United Way to contact Deb Euler for some of those resources. And then of course, as always, we do recommend at this time to go do grocery pickup where you order your groceries online. And then there's minimal contact, it's pretty much zero contact to then pick up your groceries groceries to get the supplies that you need. So that's our recommendation on how to handle those types of situations.
Any further comment for the communications we've received? Well, let's move on in quickly then right into, Scarlett, you might as well stay there because we need,
I'm just doing
some updates. Either you or Lindsay, whichever one wants to take the lead.
some updates on today's numbers.
Yeah, we've seen, this,
Okay,
I don't know if you've seen it.
You wanna go to this group real quick?
the current one, those
Either
numbers
that
there?
or the quick,
Sure.
Oh, okay.
we've just got about a half dozen slide PowerPoint here. In essence, it's just in summary of what's going on. The first slide that you see, talks about the three measures that are utilized by the state. State work finding positive testing data over a period of 14 days, decreasing hospitalization over 14 days, or decreasing in number of deaths over the 14 days. That's been reported to you consistently throughout the process, and that's the guidelines that the state has used and that the counties are using across the state. In essence, this slide here talks about understand that due to the potential increase of virus spread in our community, it will be extremely difficult to meet the state measurable guidelines. So therefore, reintegration timeline should be developed in coordination with Health Department, E-Management, Board of Health. Next slide talks about the integrated data-driven approach, which we have been trying to embrace during this entire event over the last 8 weeks. The goal is to establish a coordinated public and private sector progressive plan, thus allowing transition to additional phases of operations for local businesses. Next slide is just a summary of what you have received in hard copy today. Is there any updates on this, Tommy?
No, because this was the last update as of last night,
Okay,
the current number there.
okay.
Hospitalized are 11 as of 7 o'clock this morning.
This is Lon, I would concur, and 8 of those have been confirmed COVID and 3 are possibles, but 11 is the number this one.
So we have a different report from I guess I would ask who gave you those numbers to.
Direct from the hospital.
Scott Taylor.
Okay.
Yeah.
Sounds good.
They have a nurse's report at 7 a.m., so I just caught that report.
Okay,
Yeah,
we had a report yesterday too, so I'm not sure what
Well,
happened between there.
the 11 this morning is my understanding, the interpretation is the others out of it, and they had a number of 16 rather than 17 yesterday. But the others, the 17 or 16 minus the 11, were found to be negative.
So they're still sick, and they're in, but
Okay,
they're not COVID.
okay,
Well, they're not hospitalized is what I understood of the negative ones, is the way that it was relayed to me. But anyhow, I was told 11 hospitalized.
I think it's reasonable to consider that people are discharged, things change, people move in and out of a status. That's the nature of a hospital. And so rather than questioning which number was completely accurate, I think it's reasonable to say it was accurate at the time this question was asked or reported.
This next slide here is the positive test, or the testing performed. As we identify the positives here, you can see the positive trend, or positive solid reddish orange line there. That is the positives for those days. We've gone back approximately 1 month on this of data. We go back clear to March 12th when we first tested. But as you can see in this, the progressive trend line, as we move out to the current date, the dashed trend line is a 14-day moving average, and this indicates the number of positives that we
have over that time, the past 14 days. And remember, one of the first slides that you saw was the measuring of this over a 14-day period.
Robert, is the public able to see this? I know we don't have anyone running the video equipment.
We'll post this online. Yes.
Thank you.
And can you speak up into the microphone, please? Difficult to hear.
Will you explain that down in terms of
Say it again, please.
the last couple of days, will you explain that little piece?
Oh, yes, good point. As you see, just a brief drop off in the numbers there, you have to understand that there are two types of testing performed, correct? One, you get immediate results, and the other one can take up to a week's time. So that's why you do not see the full impact on those latter days there. So that's the difference. Here again, this is from March 12th, which was the first one, is your positive cases by, by number, and then your trend line on a moving average is the dashed line. And as you can see, the sharp drop off, once again, explained by the lag time in receiving those positives, or the results. And then the final graph that you're viewing now is the positive rate, the ratio then, if you will, of those that were positive versus the testing as a percentage. And once again, you see that over a moving average. And that is a 14-day trend line again. Once you see, you do see the, in all three cases, an increase. Once again, looking at the little bit of a drop off. Once again, it's the lag time in receiving the results. We'll go ahead and post this. Any questions, concerns, or do you have some? Okay.
Beth, can you shut the door?
So, we'll go ahead and post this following the meeting. I want to thank Dory and Steve and other staff members for putting this briefing together. Final slide is information we received from the hospital on their total positives on a monthly basis. March they had 3, April 13, and May to date they've had 6. And the numbers underneath indicate the numbers that were admitted. So in March there was 40 that were admitted. 3 of them were positive for an 8% overall positive rate. And then you can tell that in April they had 31, 13-day positive, and May to date is 11 that were admitted and 6 were positive. So that for the most part is the briefing as far as the data.
Can you go back to the slide that shows the number being tested a day, per day?
Is this the one you're looking for?
Put it in like camera.
It's a bar graph.
It's not a bar graph.
Yeah.
This here?
Yeah.
There you go. Only if I remember correctly, was it the 20th or the 22nd that we started doing the 20th, getting the rapid tests?
Are those numbers that stay pretty consistent, Colleen, around that 130, 150 mark, or there's 150 normal day?
So the 150 was at the height of last week. That was the Friday, is it? I think it was maybe the Thursday. It's the 28th. It was Wednesday. We've seen a little bit of a drop off in requests for tests this week, and so it's gone down a little bit. But as we increased that capacity last week to meet that demand, I think that helped with it. And then this week we've seen a little bit less that 110 has been about our consistent range this week so far of what we've screened.
And still running probably, what, 55% of positivity?
When I did the calculation of the last 2 weeks, last week was 58% and the previous week was 56%. This week, of course, it's hard to do that because you don't have the same 5-day to look at the full percentage of the week.
And you're
To
still
take that
waiting on
total
test
screening.
results as well.
Exactly, yep.
Mr. Chairman, and this is one for those of you on phone, and this is just a confirmation, that for anyone who maybe hasn't been watching or listening in the past, these tests are prompted by people who call in and have some symptoms of some sort, and I know there's all that criteria out there, but they're not people who have just simply called and said, I want to be tested because I want to be tested. These are people who are showing symptoms.
Right.
Is that, am I correct in that statement?
Yes, so one of the big things that we are suggesting with this and kind of the explanation of why this testing happens that way. Since this virus has such a long incubation period, we don't want to give people a false sense of security by testing them too soon. And so we have seen several cases where we've tested them about 2 weeks ago when they said that they had symptoms, and then now 2 weeks later, they're really, really sick and they're likely positive and we're having to retest again because of their symptoms, and then they're becoming positive now. And so it's really kind of interesting how long of an incubation period potentially you're seeing with this virus before they are testing positive.
You just
So the
raised,
sensitivity of the swabs, we want to make sure that we're getting that.
excuse me, I didn't
Sure.
mean to interrupt, but you just raised another question with that comment. So, and I'm just pulling examples out of the hat here. On April 20th, it shows 46 being tested. On April, whatever, it shows 150 being tested. So it could be that that's the same individual that was tested in the 46 that was tested in the 150 in my example. I know that's not the true case, but it could be the
Right.
same person being tested twice.
So this
Am I
is a
correct?
very, very few that this has happened.
Okay.
It's been upon a physician's order to then retest
Okay.
because of their screening within, so their primary care physician kind of knows them a little bit better. We've done strep, we've done flu, you know, we're eliminating the others. So this is not a common practice that we test 2 times. It's in those very urgent, specific situations, so it's a very low number. It would be less than 5.
Okay, all right, thank you for that clarification.
Sure.
I might expand on it. I've had a few questions. I know a guy who knows a guy who knows a guy was been told he has been exposed. How long does that individual usually, did you wait for symptoms, which is what, a week, 10 days before that person who's been told he may have been exposed?
So each situation needs to be evaluated in its own, and so I would suggest before I speak to a particular situation that we do know the full exposure.
Call the hotline?
Call the hotline to be screened. Generally, we're seeing symptoms appear within the 5 to 7 days. However, that doesn't always guarantee that you will be positive. And so really it's the best to evaluate each situation individually.
Then you may not catch it anyway, even if you have. Robert, would you,
So
do we
you
need to
talk-
move on to, are we,
Well, we have Skylar here, and one aspect of our response is your EMS program here. And I think Skylar can possibly share a few things that his experience over the last few weeks.
before we're going,
Yes, sir.
she'll be back.
I'm doing circles.
She'll be back.
Okay. You're up.
Morning, Scott.
Morning. We'll give you just a little bit of data here on what we're seeing on our side of things. And so really prior to about April 26th, we weren't seeing much of a COVID response as we weren't going out much to take care of people. However, since then, April 26th, we had one call and then one after that. So we kind of started to see a steady increase. We've kind of leveled out here a little bit. So from April 26th through the 30th, the end part there, we had 10 calls and we transported 9 of those people. These are 10 calls related to COVID in some sort of way. And then from May 1st until today, or including yesterday, we had 18 call-outs and we transported 10 of those people. Prior to that, we had just very, very few. We usually go a shift without having, and maybe we'd have one possible. So we are seeing a little bit of an increase there. It is kind of starting to level out here a little bit, and it is sporadic. Like May 3rd, we had absolutely 0. The next day, we had 4. And so that's where we're seeing a little bit of an increase there. But it looks like that just over, if you can go from April 26th to today, we've been called out for COVID-related response 28 times, and we've transported 19 of those people. So we do get the worried people who are symptomatic but not necessarily in need of hospitalization, and we go there to evaluate those people. Additionally, we do provide some assistance for emergency management and health department for doing some checks on those that are in the non-congregate housing. Sometimes we go there, if they call and during their phone call with him, they find some issues with him, with a person there that they need to have some eyes on there. We'll go out there and take a look at that. So we've only had to do that once so far. So, but yeah, so since April 26th, 28 responses, 19 transports.
Mr. Chairman, minor just clarification questions, Skylar, and this is long for everybody listening on the phone. Couple clarifications. When you say transported, I assume you mean transported to the emergency
That's
room?
correct.
And then the second question is, when we say that they're COVID related, have they tested positive before you've responded, or are they tested positive once they get to the, how do we know that they're
So
COVID related?
our criteria there is confirmed COVID means that we have been informed that they have been tested positive. All right. Additionally, we do have a couple that we put as suspected, where that we believe those people are at high risk. They haven't tested positive, but they're symptomatic and with the same symptoms, and they live in the same places. Or they tested and are waiting on the results by the time we look at it.
I was just trying to get a better understanding of your data. All right. Thank
And
you.
then we do have to be careful because we do factor out, we've had a couple calls, we had to go back and factor out where it was a COVID person that was transported to the hospital for non-COVID, like a car wreck. Someone who's in a car wreck, they're COVID positive, but their broken arm wasn't caused by COVID.
Right. And lastly,
This is Dr. Burns. I
would
would like
some
to
of
clarify that
those
point though.
be, would it be
In
safe to
medical
say?
practice, can you hear me?
Yeah.
In medical practice, there is part of medical practice is you have to have a clinical assessment, and then you can do diagnostic confirmatory tests. But if we waited for a confirmation COVID positive test on everyone that comes to the emergency room before we don PPE, before we put that person in a negative pressure room, the amount of exposures would be enormous. Similarly, if we think someone's having a heart attack, even before we have the EKG or the troponin, if they're exhibiting symptoms consistent with a heart attack, we treat for the heart attack because time is of the essence. We begin that treatment course, and then we do confirmatory testing. That is the nature of medical practice, and that is what clinical decision-making looks like. Now, absolutely, confirmatory testing is important. All of us are aiming for accuracy. Nobody is wishing to mischaracterize any diagnosis, but it goes back to that hospital capacity question too. When we're looking at what our hospital capacity is, that's the number of negative pressure beds, that's the number of people that they're able to accept, whether they have a clinical suspicion or a confirmed test. Maybe as testing comes back and those people change status, then they move out of that capacity. But that's why those numbers sometimes move. But you cannot wait, especially with the time lag that we look at for getting some of these tests back. If it's not a rapid test that's deployed, you have to have a clinical assessment of the patient, and that is valid.
And Mr. Chairman, I'm not doubting your numbers and your data. That's not the point of my questions. My point is trying to get it in proper context. The 19 that were transported, then those calls were due to somebody has the virus and they did the call, or you mentioned the car wreck, broken arm example, Or was it because they're suffering a heart attack or a stroke or something, but then in that process, you found that they were COVID confirmed?
Yeah, most of my data is all related to, what I've given is related to COVID in some way. It's not, now I don't, I don't have data on someone came to us with, they were a possible risk, and they came to us with symptoms, and then what they found in the hospital, I don't have that data on that person. I just know that they called us, either they were suspected COVID due to they're living in the same house, whatever. I don't have any idea if they once they got to the hospital.
And the reason, just quickly, we hear that type 2 diabetes is an underlying health concern of many, not just Finney County, but throughout the country. And Lindsey Burns mentioned last time stroke possibilities, and then we know heart issues and high blood pressure and all that. So that's the rationale for my question. Thank you, Mr. Chairman.
2 questions, Skylar. Since we might have a surge, how are your personnel? Are they healthy? And number 2, how about PPE? Are you prepared?
Yeah, we're still, we're very fortunate there with PPE so far. We've been working pretty closely with emergency management there. They've been providing us with the PPE that we need. They've been very responsive, and they've been actually able to acquire quite a bit. I don't have any shortages right now. N95s are good. We were kind of short on gowns there for a while, but we've got a solution for that. We've had some disposable gowns increase there. We've got some more of those. Additionally, we do have some gowns that we can reuse and disinfect we just recently got those, so we're pretty happy with that. Additionally, we continue to use ServiceMaster and Lewis Motors to help recon our vehicles. They've been especially helpful. Staff-wise, I've only had one person that I've had to take off for a short period of time. They've come back negative. So I haven't had any staff shortages of any significance. Thank you.
Further questions for Skylar, guys? Carry on.
Thank you.
I want to take a moment to remind everybody to speak into their microphones and maybe announce your name so people online can tell who's speaking.
I talk all the time. So.
Would you like this is Robert, would you like a update from Stephen on the accommodations that were on housing accommodations? Is that something you would do, Stephen? An update on
Sure.
that?
For the Public Emergent Manager Director Stephen Green's coming forward to speak into the microphone.
Good morning.
Morning.
For a quick update on that, we have 2 facilities that have been identified through KBHE and KBEM. One's our American Inn, and that's for those individuals that are, they've been exposed. It's been documented that they have a family member that is positive, and they maybe presented symptoms, and they may be waiting for a test, or they've been tested and waiting for results. We can place those individuals in the American Inn. We have the support from the National Guard that are providing logistics there. We're providing meals there. We're providing laundry service, things of that nature. Now, for those that are tested positive and need to get out of their living environment because no one else in their household is potentially positive or have been tested positive, we've got the sleep in. And those individuals are afforded an opportunity to shelter there for 2 weeks in strict isolation. And again, we've got the National Guard and our Department of Family and Children are functioning as a shelter manager. So at present, we have 8 individuals at the sleep in, taking advantage of that opportunity to protect themselves and their family. And we have 1 individual at the American Inn. We anticipate that population going up today. We've got some people that have reached out to us about utilizing the American Inn for the potential exposures. So that's where we stand with that. And we're fortunate to get support from the state for that and the National Guard. We're very grateful for that.
Excellent.
Mr. Chairman. Again, just clarification questions, and I very much appreciate Sleep In and American providing that assistance to you. But if few weeks ago, there were news releases about, the 3 community colleges out here, and housing, Garden City Community College, Seward, and Dodge City. Is that not being utilized? Because I thought all 3 of those community colleges had come to an agreement as far as providing some of this housing that you're talking about.
Yeah, there's been a contingency bill, if we get a surge, we can accommodate that, some facilities have been identified at the community college, but that's our, worst case scenario.
The backup plan.
Yes, sir. And they are providing meal support for those that are in isolation, so they are playing a role. But we don't wanna, utilize their facilities unless we absolutely had to.
I wasn't aware of the meal support.
Yes, sir.
Thank you for that.
And there's also some private, venues out there too that are providing some meals as well.
Thank you.
Yes, sir.
Clarification for this, Larry. They're sequestered for 14 days.
They're offered the opportunity to stay there 14 days. Now, we have no control over that. They've been advised when they do leave, they leave at their own accord, and they're not welcome back.
Okay. So everybody's been taking advantage of that, though.
We've had at least one show up and not stay. We've had one initiate the process and withdrew before he arrived. So, there's some, it's kind of all over the place, really. But the opportunity's there. We make sure they know what they're walking into when they come to it. Strict isolation. Those that are the shelter manager and the National Guard units are wearing PPE. For Dr. Burns' request and directive, they're getting medical checkups. There's a liaison through the health department that I'm sure Colleen and Dr. Burns could elaborate on more than me. So there is follow-up processes and protocols in place to, continually assess those individuals that are tested positive and that are sheltering.
Mr. Chairman,
So,
again, just a clarification. So the 8 and 1 that you mentioned, those are referrals to whom, from whom?
those are individuals that test positive that come through our drive-through testing protocol. And they're given a package that Colleen referred to earlier. They're given a number they can call. And once they turn that system on, we cross-check that individual, utilizing initials and date of birth only, their names, with their health department to indeed determine they have been through the process, they have tested negative. And then there's a form that's being put together that gets populated through the health department and coordinated through our medical director. And at that juncture, we turn on the logistics to allow that person to come to the shelter. And that usually happens out of our office. We contact the shelter manager and provide any transportation needs or anything along those lines.
Okay, thank you.
Yes, sir.
Mr. Chairman.
Dave?
This is
Sure.
Dave, for those on the line. Steve, you said, did you misspeak perhaps, or did you said that when they test negative, that they're put into this,
It's for the merit.
No, yeah, I'm sorry. go ahead.
positive test, would it not?
Yeah, a positive test is at the sleep in, okay? Somebody that needs to get away from their family that can't shelter in their residence.
Okay,
Now, if an entire family is tested positive, they're encouraged to shelter in their residence, okay? But if they need to segregate that family, we can offer that service.
Okay.
The American is somebody that's maybe presented symptoms other than anybody else in their household, but they haven't got the results of the test. And we provide an avenue for them to isolate so they don't expose anyone else.
So they would not necessarily be there for 14
No,
days.
sir, that is correct. That is correct. Thank you.
Thank you, Steve.
Yes, sir. Thank you.
Colleen, you might as well come back up, because we're probably, Robert's going to lead us a little to the next step.
Mr. Chairman.
Oh, you wanted a question?
I have a question for Colleen. This is Dave again. Colleen, we saw some demographics that I appreciate from time to time about job location. Part of those demographics included job location, and that I want to be careful and not cast any sort of dispersion on our meat industry, but so many of those were from the packing industry. So my question to you, have there been any positive tests from the personnel at, say, Walmart or Home Depot, those stores that are open, and
and the public's coming in, it will.
So we follow KDHE's criteria on announcing clusters and outbreaks at specific locations. We've also tried to set up some sort of regulation in how we release businesses as well. It does take, of course, contact tracing and a pretty lengthy investigation to trace back employees to a specific employer, but it is something that we are tracking. We have also decided to only release the businesses that have 5 or more positives and release it as an outbreak announcement. So that's the criteria that we're
Then
using.
I'll reframe my question, have 5 or more positives come from either Walmart or Home Depot, some of those stores?
Not that I am currently aware of.
Because, part of my question centers around, we have community spread, which tells me you have no idea where they were infected. But then a majority of your cases reported in the demographics are not community spread. It looks to me like, reading between the lines, you know where that person was infected or have a pretty strong suspicion. Is that correct?
I guess, Dave, I would have to probably have some more information around which ones you're currently speaking to, to understand.
I need to be
Yeah.
careful, so.
Yeah, yes, I'm not sure exactly.
I can weigh in on this a bit. So community spread is an epidemiological definition described as 5 or more cases that have been identified that have not been tied to out of community bringing that case in. So whether tied to travel outside the community or otherwise. Initially, when we started identifying positive cases through our disease investigation, we were able to identify people who had a significant travel history and tried to extrapolate that. Now, that being said, we can't ever say exactly where someone is infected, especially given the contagion level of this disease. Now, there are conditions, certainly, that, including just more congregate conditions, that ease spread. I would say that if we more widely tested folks, we would identify more people in more businesses. And if we want to assess risk versus risk versus risk, the idea is to be consistent, is to decrease the contact and the physical distance between people in businesses, whether it's a big box store, whether it's a meatpacking plant, whether it is a household. That's the idea. So that intellectually needs to be applied across all facilities. So community spread is an epidemiological term with a definition. What I think is important to understand from a principle is that virus doesn't stay in a location. It travels with people wherever the people go, whether it is to their home, whether it is to the store, whether it is to their employer. So while identifying clusters is important, especially in trying to change the way that people are congregating in those clusters, that's important for understanding, how many cases are associated with a place, but that is not to say that those cases will stay in a place. And I think that as we talk about regulation going forward, we have to keep that principle in mind.
Okay, thank you.
Let's move forward. Gentlemen, where do we go from here?
Do we have anybody from the hospital on the phone that was wanting to perhaps give an update on what they're seeing directly or their efforts? We did have an invitation out to them.
Is there anyone from St. Catherine's on the line?
I can speak to discussions this morning with 2 physicians. One of this Dr. Clifford. I spoke to the pediatrician because I was concerned about the childhood issues. Even though we're showing only about 6% of the positives in the population under 19 years old. They run sort of morning wellness clinics, afternoon sick kid clinics, just to try to separate, doing a little telehealth. There isn't a large proliferation among children, but there are some cases cases. There have been 2 babies born to COVID-positive mothers, so that's certainly a concern when you consider the close contact postpartum. The virus is not spreading through the placenta, unfortunately, like Zika was. We don't appear to have Zika on our hands, but obviously there's a dilemma when a mom's positive and a baby is born. An internist reassured me of the capacity of the hospital to handle a surge. They're still bracing. They have had several staff now, including a nurse practitioner, infected, so those people are lost to the hospital. There are people from Centura coming today from Denver to assess our situation. So the hospital still expects a bit of a surge, but what they've seen in the hospital, mainly healthy young people who are able to survive this disease. The worry is those people, as Dr. Burns indicates, as they bring, not those people, but probably asymptomatic carriers, as they take that disease home to a multi-generational family, will subsequently see the more vulnerable come in. So currently the situation is manageable. The future is somewhat unknown.
And Mr. Chairman, this is Lon, and I would just simply add, because my sources are different than the ones that he, or my source, I have a single source, but it is hospital leadership that has a handle on it, so it's a very reliable source is what I'm saying. And the quote he gave to me this morning about 7:30 is it's not a serious challenge to our operation, and we have a surge plan if that surge would in fact take place. But that was also where I got the numbers this morning for hospitalizations.
Okay, again, I ask, where do we go from here?
Well, at this point, you have the option now to begin your discussion. You probably should hear from your health officer and your medical director based upon the information that you've heard thus far this morning, which we try to be very comprehensive about, making sure that we touch everyone that is impacted here as far as your healthcare operations, whether it's the testing sites, your housing sites, your EMS response, and your hospital. And so we want to make sure that we covered all of those so that you had the best information available as you move forward. So at this time, you would want to specifically ask the health officer and medical director what they're seeing, what they may be suggesting or recommending at this point in time.
So let's go first.
Well, so I'll give my recommendation. So given the data that was presented today, along with the criteria set forth by the state, which was what Robert went over on the first slide, I have an obligation as local health officer to recommend a stay-at-home order for at least a week with a preference to 2 weeks. I'll let Dr. Burns also speak to what her recommendation would be.
I concur, my recommendation is the same.
Dave?
Mr. Chairman, for those online, this is Dave with a question for both Cooley and Dr. Burns. What is different in Benton County in terms of disease transmission from Ford or Seward County, where they have more cases, more positives than we do, but they're operating under the governor's phase 1, not the stay-at-home that you're advocating? So, to me, my preference would be, and what I'm hearing from just dozens of people who light up my email account and my telephone, they want to see the small businesses be allowed to reopen and spread out those people that are congregated at the Walmart and the Home Depot that I referenced. So if you want to speak to that, is there something different here than Fort County's experiencing?
This is Dr. Burns. I think the difference is that this is a local decision. recommendations to Ford County, I make recommendations to City County. I believe that the safest, best healthcare, medical-minded recommendation is to adhere to the guidelines as set forth by the administration, as set forth by the CDC, as set forth by an epidemiologist. Now, the role and the obligation of myself and Mrs. Dries is that we make the best medical recommendation to you. It is not to be swayed by opinions or emails or threats. It's supposed to be a medical recommendation. Now, I completely agree. I think that we need to have actually more regulation about physical distancing amongst people. But at this time, it is my role to make a recommendation to you based on the data, and that's where that's coming from. Without influence or prejudice.
This is Commissioner Dwayne Grease. I am one of the exempt operations. I'm a farmer, and I'm out to repair shops and so forth. And my notice over the last 10 days is people are not following these stay-at-home. This morning, coming to this meeting, Kansas Avenue was just as busy as it ever is. I think I would highly encourage people to stay home if that is their choice. I'm not saying that. I disagree. I think your mandatory stay-at-home order is being ignored. And probably at best 40% are honoring that order. And I think that same 40% would be more than happy to continue that. I do not believe the mandatory order is working, and therefore I am adamant, rather, about letting our small businesses downtown survive. I've been in business my whole life. My county commission paycheck is the first paycheck I've ever received in my entire life.
And it's a big one.
Oh, and it's a big one. I get $362 every other week. So, my point is, the big box stores will survive. Our downtown businessmen are going to be facing bankruptcy. And I do strongly believe that they ought to be given the opportunity to survive. I'm very okay with negotiating numbers, restaurants, so forth. I can appreciate large gatherings of people, and that should be limited. I will not argue that point one little bit. But in this past 10 days, every single email or contact I've had, 100% has been encouraging business to open. Not a single one has come to me requesting that the pandemic shutdown maintain. So I'm going to open it up to comments from further other commissioners. Dave?
So again, this is Dave speaking. Would you, co-leading and Dr. Burns, consider turning this around just about 180 degrees from your recommendation and let's open things up on a trial basis, if you will, to the governor's phase 1 recommendation. And then if we see a spike, a downturn in the number of positives, then we can reinstitute the plans, the stay-at-home and the closed businesses up. But turn this around just a little bit. When businesses are ready to go bankrupt, to me, it's time that we consider some other alternative.
So Dave, are you saying, are you suggesting operating phase 1 for 2 weeks? Upon completion of that 2 weeks, we analyze the data and use that data to essentially make the decision to move to phase 2 or remain in phase 1 or return to stay-at-home orders?
That's exactly, I'll repeat what my thinking is. Go, starting Monday, go to phase 1, governor's recommendation for say a 2-week period. And then if you see a spike in positive cases, we convene this group again and we consider your opinion about let's close things back down and let's stay at home. That order be reinstituted.
So to just speak on my behalf as local health officer, again, I would be agreeable to that. I do think the best foot forward in the recommendation is a stay-at-home order since we're seeing such an influx now. However, I'm agreeable to following the criteria set forth by the state to reevaluate after the initial 2-week period, and then either make stricter or more, or follow along with phase 2. But I believe the best bet to follow along with the state is to remain in that phase 1 for 2 weeks and then analyze data.
At this point, Robert, can you outline exactly what phase 1 is for the governor or Colleen? I don't care who does it. What is the exact outline for phase 1? There's another piece of paper.
Yes, I have the governor's reopening plan in front of me. Phase 1 without still limits gatherings to 10 maximum. Restaurants are open 10 per table, 6 foot apart. Our state did not specify a maximum. All of the states have said 50% capacity, et cetera, in these.
Some counties have even done 25% capacity. I believe Wyandotte has a 25% capacity on restaurants.
And one has 10%.
Libraries would open daycare camps as opposed to daycares, which are open. Daycare camps would be allowed to open. Retail would be allowed to open. And obviously, us in the healthcare professions, dentists, et cetera, optometrists, it would be up to us as people who practice and understand the issues involved. That's phase 1.
Mr. Chairman,
You want?
at the risk of running over my time limit, this is one for those of you on the phone, and the chairman and I have this running, well, I started to say joke, but I think he's serious that I talk too much, and so at the risk of talking too much this morning, I first of all would buy into the phase 1. I wish we would do more than that, but I could buy into that. However, the phase 1 for the state ends on May 18th, but we're talking here. I just want to make sure everybody understands what we're talking about, that we still would not be in sync, if you will, with the state's phase 1, phase 2, based on what it is today, because phase 2 starts on the 19th or 18th to 19th of May. So I want to make sure people understand if we did go that route. But my comments are this. First of all, I had an attorney who has practiced for over 40 years, is very astute with Kansas statutes, who feels like, even though it says at the beginning of the statute that there are broad powers, that the health department, the health officers' powers are to give permission to keep sick people at home and limit public gatherings, but not to shut down businesses or to keep healthy people home. So in fact, his interpretation of the statute is it's a quarantine of the sick, not a quarantine of the healthy, and those are my words. Secondly, I look at the hospitalizations and the deaths more than the confirmed rates. And the death has stayed at 3 here for the last, week or 2 or something. I don't remember when we got those. Yeah, a week then. We had those last 2. And in my small circle, the death rate in my small circle has increased by 2 just this week. And I'm up to 14 with family and friends. And those friends include neighbors. The 2 this week, one of them was the night before last, was a neighbor. And the concern I have is that people are not able to properly mourn. So again, I go back to, this is lives versus lives, in my opinion. Yes, there's an economic impact to this as well, but it's a life versus lives. And then I'll wait till Elaine gets back to the microphone, but the last part of what I'd like to say here, Mr. Chairman, is I don't think anything is being said to any extent at all. That yes, this is a respiratory virus. I understand it affects the lungs, and I understand all those medical things. But we're not talking about that it's an immune system issue. It's an immune system issue that if we do the vitamin A, D, and C, if we do the sunshine and I have a chiropractic office, contact in Overland Park, in Johnson County, who put out the, recommendation to get sunlight 20 minutes twice a day without sunscreen as a grant answer to combating this virus because, and I'm digressing here for a second, there's a business here in Finney County who requires every employee to have the flu shot. And yet this winter, in December, January, I don't know the exact time frame, they had so many people absent because they got the flu. And yet they were required to get the flu shot. It's an immune system thing, and when I was out the other day, I ran into a doctor and a wife who did not have masks, who don't believe in wearing the mask, and who said to me that we've got to work on the immune system, and prolonged use of the mask causes us to breathe in our own CO2, and also that the prolonged isolation causes us to causes our immune system to be weakened rather than strengthened. So these are not arguments for or against, these are just my thoughts. But I think we're not addressing the right issue as we combat this virus as well as the future viruses that we're going to get. And then lastly, I would say this, my communications up before Monday, before our meeting Monday, we're probably running about 70% in favor of opening up Finney County. Since Monday, it's been 100% communication, text, phone, email, and so forth to open up the county until I came in this morning and saw that one email question that Dory read to us. It was 100% until that email this morning to open up Finney County. So thank you, Mr. Chairman, and I'll try not to use quite as much time next meeting. Oh, I didn't go over a
Dr.
little.
Burns, may I address Commissioner Pishne's comments just now?
Yes, please.
Your characterization of the medical condition and the immune system is flat out wrong, sir. Flat out wrong. And I would challenge you to read clinical evidence and abstain from spreading anecdotal evidence.
Just to back up Dr. Burns' comment, like, for instance, the country of Sweden took an open society approach to this disease, and certainly they were applauded for doing that at first. Now their results are miserable. Their death rate approaches 10%. That's always a hard number to nail down, but even with some biases, that's probably 10 times or 20 times what's being seen in other similar first world countries. So I think we have to be careful extrapolating from others' experience, but we do lag since we didn't see this virus probably even 2 weeks after Eastern Kansas. I would like to comment, Dr. Clifford again, would like to comment on the other counties. I spoke to Sean Tassett in Ford County yesterday, and Mason McCafferty, County Commissioner in Seward County as well. In conjunction with their health officers, they did proceed to phase 1. They were seeing a leveling of cases, they wouldn't admit to it being decreasing. So they went with sort of a leveling out. I'm struggling because the public hasn't seen it, but what we saw here this morning was a 1-week lag in the data, and we understand why that's occurring. So I'm confident we're prepared for a surge. I just would like my fellow commissioners and public to understand, given our numbers of positives, I'm expecting 20 to 30 deaths in Finney County. I realize we're showing 3. But that potential is there. We're opening up it as almost an experiment. I do like it to be data driven, and so opening up, looking at the numbers and deciding whether to close back again is one of the alternatives. But it's one I have trouble supporting right now given the medical data.
Mr. Chairman, this is Larry Jones. after listening to all my fellow commissioners' comments, I am not gonna delve into the medical field. I'll guarantee you, I'll be way over my head. But my observation is, I'm kinda like the chairman. I'm in the ag business, and so it has not affected my business much, other than my markets, it's killed them. But, as far as my personal life and daily routine, it hasn't changed much, other than I can't go to mass and I can't go to my favorite restaurant. But just casual observation, if I was running a small business somewhere in Garden City and observed what was going on at the big box stores, I would be upset immensely. Because most people do not appear to be abiding by the stay-at-home order at all. And I don't know what good doing 2 more weeks of stay-at-home would do, other than just gonna cost our small business operators more money, more time. I think they're intelligent enough to regulate how they want to open their business, how they want to keep their people safe, and how they want to keep their customers safe. They would probably do a better job than I would say the large businesses.
And if they want to open.
And if they want to open. And I'm very much in the camp, if you're an at-risk person, and you know, I'm one that has hay fever, and this time of year is terrible for me because of the wind and dryness, but you stay away from people. You don't congregate. And you know, most people are gonna use common sense, I would think.
I'm gonna piggyback on that one a little bit. This is Commissioner Grease. Like I stated earlier, small business, I am very much negotiable on large crowds. If it's a compromise to get my Main Street businesses open, I'm perfectly happy to restrict restaurants to takeout only for another week. Churches, fine, I'm sorry, I missed mass myself. But, I'm very adamant about the small businesses. Dr. Clifford, you're way ahead of me.
Dr. Clifford, I agree with both my fellow commissioners here. I mean, I'm a small businessman, and we are seeing about 5% of our normal patient population due to restrictions. Ironically, as I leave this meeting today, I will be driving to Thomas County and seeing patients, elective laser surgeries, because they're open and it's allowed there. So I do feel the pain of small business. There have been some remedies, and we welcome, of course, folks to bring their applications for the CDB funds here to us. I'd just like everyone at the table to understand, if we go this route with the data we have so far, it's an experiment, and we have to be willing along with the public to reverse course if we see the surge develop.
He's, Mr. Chairman, this day, I believe Commissioner Clifford is stating exactly my position. Let's give the phase 1 governor's recommendation a trial.
Mr. Chairman, a couple of comments. One, I'm monitoring Colorado as well as Kansas because of communications that I received through Centura Health, and it's been interesting to compare those 2 states. Secondly, I believe that we are in a country that is based on freedoms, and just the other day, there was a store that I wanted to go into, but the sign on the store said that a mask required. I chose to go shop somewhere else because I didn't want to wear the mask. I think the businesses have that option to, just like they can say no guns carried in here. I think they have the option, but we as consumers also have the option. Thirdly, the essential versus non-essential is really troubling to me because some of these self-employed, the essential thing they're trying to do is feed their kids, trying to feed their family. And they don't have another, and I'm sorry, Bill, but this is not a negative on you, but they don't have another county to go to in order to make a few dollars. It's only here in Finney County, and that is concerning to me when we categorize essential versus non-essential, and I'm concerned about that. And then, the other two are questions. One, the one question, say we were to, vote on, well, actually, it's a three-part question, I guess. If we were to vote on a motion that Dave has suggested to start phase one of the state's plan and do that for a 2-week period, part one of my question is, would that mean if we didn't see any spike or increase, that we would automatically move to phase two at the end of that 2-week period if we didn't see something negative? And then the other is, what is the definition of surge or spike? Those are the two words I've heard. What's that definition that creates that drives our decision to go another direction? And thirdly, if we were to pass that motion, what is our assurance that it won't be overridden by the county health director or health officer, excuse me? So it's kind of a three-part question related to the suggestion that Commissioner Dave Jones has mentioned.
I think, ladies, you have the commission's general idea. Having heard our discussion, what's your response before we proceed any further? There's no point in us passing a resolution if you're going to pull the trump card on us.
Correct.
Lindsay, would you like to comment first?
I'm sorry, are you talking to Dr. Burns? Or
Yes, yes, please, Dr. Burns, would you comment on, you caught the commission's general consensus or thoughts? How do you respond? Is there a middle ground that we can work with?
This is now 4 meetings that I've given you my recommendation. The statute's written the way it is. I think you take your action and you either decide that you can go along with expert recommendations or you don't. That's the choice before you.
Not true. There's many, many sides and facets of this that the commission has to look at. We are the elected government body, the Finney County Extension of State. It's not just one side of an issue for us. There's many facets. We have to look at the whole picture.
Because hold it before you start to speak. You are officially our public health officer in Finney County. Am I not correct on that? Because I've had people ask me that.
So as health department director, I was sworn in as the local health officer, yes.
I want to make sure that's all right.
Because I'm not an MD, I have to have the medical director's backing for any orders. You have heard our recommendation at this point. I have no intention of enacting a stay-at-home order because I've given the decision to you. We've given you our recommendation of what we feel is best. I feel that that is up to the local board of health to now make that decision of how you'd like to proceed. I feel better about ensuring that in 2 weeks, to kind of speak to some of those questions, in 2 weeks, we reevaluate what that data looks like, if there's an increase in the positivity rate, so of our sample size, X percent is coming up positive. Last week it was 58%, the previous week it was 56%, but if we continue to see an increase, that's when I would, again, recommend to the board of, the local board of health that we enforce stricter restrictions. But I don't want to continually have to go back and forth with the local board of health. Again, we can only make our best recommendation of how we would like to proceed, and it's up to you.
Mr. Chairman, in order
Mr. County
to,
Counselor, Kristen Kian. And I just wanted to address also the concerns of, why follow continuing the present stay at home, because we know some people aren't following it. And You know, I hear, obviously, I'm talking remotely, and I hear from some observations that there are some people that aren't following the present regulations, and that certainly is a concern. And, you know, perhaps the way to address that is to have stricter enforcement at those businesses, rather than just to say, we know people aren't following it, so let's just open up. I mean, for instance, we have laws against the use of methamphetamine and heroin, and we know those drugs come through Garden City and other places all the time. We know people constantly are skirting those laws, but we don't answer that by saying, well, we're just not going to have a law against production and transporting meth or heroin. We're still going to enforce those laws because those drugs are harmful to our citizens. And so just because we know some people don't want to comply or aren't complying, I don't think is a rationale to change the law. I hear, you know, the economic concerns, and I understand that those, you know, are another consideration that everybody is concerned about, but just the fact that people are skirting and not following, I don't believe would be justification. And I'll just also weigh in, and maybe this is something to talk about in the future, that there are some concerns that there are businesses that are open that have actively flouted the regulations that their workers get tested, and that there has been some anecdotal evidence. I don't think that people are ready to talk about that at this time. This might be something that's addressed down the road, that perhaps the numbers presented today are actually low, because these businesses aren't allowing all of their people where there are high infection rates to get tested. And so I think that's something that commissioners should at least be aware of, and that the infection rate is actually even much higher than what we're hearing today. And that's it.
Mr. Chairman, Dr. Clifford, by way of compromise, and I'm not sure if we are directing our health officer to extend an order, or we ourselves are doing that. I defer to our administrator to guide us. But I would move that we at least extend our closure to by 1 week, so that we might revisit this. We do have a scheduled meeting on the 18th. I propose even coming back here in 1 week on the 15th, so that we might reevaluate for Oakland County to currently extend the order for at least 1 week.
There's a motion on the floor to extend the stay-at-home order for an additional week. Is there a second? Hearing no second, that motion is died for lack of second.
Mr. Chairman, this is Dave. An observation or two. I have, among all the phone calls I had, please let us open, and one of those was the owner or the proprietor of a restaurant. And he told me that if he was given permission today to reopen his restaurant, he could not do so for a 4 or 5 day period at the very least, because it'd take that long to get the products in to cook and make salads and whatnot. That there's going to be a lag period. My observation also, looking at the calendar and at the governor's order, on her order was for a period of time that for phase 1 to be reconsidered, I'm going to use that term, on May 18th. And then on the 18th, either extend phase 1 statewide or go to phase 2. Coincidentally, our next scheduled regular county commission meeting is May 18th. So I guess I would offer this motion that we go to phase 1 in the county in lieu of the stay-at-home order, but go to the phase 1 governor's recommendation until May 18th, and then Colleen, if you folks could be prepared to address the topic again and see if there has been a surge or a spike, whatever term we want to use, and if we need to alter course and backtrack, or is it time to continue with the phase 1 concept on the 18th or go to phase 2? So
I would second that motion.
That would be my motion.
That's quite an extensive motion.
Well, do that. I'll make it a
Can you
little more.
paraphrase that to make it easier
I'll make it a
for?
little briefer, that effective this Monday, when their stay-at-home order expires, that we go to the governor's phase 1, and we leave that in place until May 18, when we will revisit the situation.
Is that agreeable to the second?
Yes.
Okay, now discussion.
Would you, consider comments from your health officer at this point in time?
Comments from medical, please.
I would strongly recommend a 2-week period, not a 1-week period, to analyze how those lessening of regulations impacted our positivity rate.
That's a 10-day period that I proposed.
The state recommends a 2-week period. And so that would be my strong
Phase
recommendation.
1.
That phase 1 for 2 weeks before moving
Either
to
way.
phase 2, yes.
Or even staying in phase 1.
Yes, we could remain in phase 1 for additional time, but you need that 2-week period of time to ensure accurate data and analyzation of that data.
Again, I'm not, again, this is, I'm not in great opposition to the 2-week period as opposed to the 10. I think we're talking basically at the same time. It's just that we have a regularly scheduled meeting on the 18th. We can revisit this and see where we are.
Mr. Chairman.
Is there more discussion?
Well, this is Lon, and I'm certainly not disagreeing with what Colleen is suggesting. However, 2 weeks is Memorial Day, 25th, the Monday is Memorial Day, 22nd. I'm probably not available for a meeting. So if we're looking at orders in weeks and days and times and so forth, I think we need to keep that in consideration. I appreciate what she's saying about the 2-week period in order to gather data. I would ask too, though, that we monitor the hospitalization rates as closely as we're monitoring the confirmation rates. Because I think that's as critical as the confirmation rates myself. That's just me personally. But,
The hospitalization and the death rate would be part of
well,
that
that's
criteria.
yeah, I guess I just,
Yes,
you know, took
Yep.
that as part of it without saying it. But, so I don't know. The motion right now is to, if I'm understanding, Mr. Chairman, is to do phase 1 until the 18th. Am I correct in that understanding?
That's correct. And then revisit afterwards. Dr. Clifford?
Obviously, I follow the medical data more closely and won't support this, but I would just like to say I'm very sympathetic towards small business. I'm a small businessman, keeping over 30 people employed by very many ways. I would like to emphasize to the public and these businesses that if we do vote to open, it's incumbent upon them to enforce these recommendations of masks and of physical separation and protecting the public. Because if this blows up, we'll be reversing that. So I know the emphasis here is on liberty and personal responsibility. And as our county counselor has referenced, maybe just because we're not seeing it in certain places doesn't mean we should just open it up in other places. But I think if we're going to take this step, we have the citizenry who needs to respond in kind to help us to the next phase.
Mr. Chairman. Dave, again, responding to Commissioner Clifford, I agree wholeheartedly, Bill, with what you were stating, but the governor's phase 1 has those safety protocols, if you will, the mask, the distancing and so on, as does the document that at our last meeting we approved as guidance for the county's reopening, the document that was presented by our economic development people. So it's going to be incumbent on those businesses that when they reopen, they do so as safely as possible. So I think we're all in agreement.
I would agree with your, Mr. Commissioner Greasy. if this motion passes, it is highly recommended by the commission, be very clear that businesses use common sense and follow the guideline that is updated on a regular basis from economic development. And also, I would like to be very clear that if you, as an individual, choose to stay home, I highly encourage it. I mean, this is not a mandate that you do not stay home. This is just freeing up those that do not want to. For the 40%, 50%, 60% that are already staying home, please continue to do so if that's in your best interest. That's not the point. This is not a mandate to go out, visit the park.
Mr. Chairman, this is Lon, and I just wanted to quickly endorse what you just said. This is not a mandate to go out, and if you feel you need to stay home, I just would echo that. Let me, and that was a preface to my suggestion, and I don't know how you want to handle this, Mr. Chairman. But given what I'm hearing from the motion, given what I'm hearing from Colleen, what if we said 2 weeks from today, which would be the 22nd of May, that the phase one would be in place? That would give you the full 2 weeks from today for your data questions that you have, and it would be a little bit longer than what Dave had said with regard to May 18th, but we're just before the Memorial Day weekend as well.
If I may make a suggestion.
No, I'm asking, that's a question.
Oh, okay. So I would suggest that you go into perhaps a local board of health meeting on the 18th as scheduled,
Okay,
but that the time period goes until the 22nd. That gives you enough time to make decisions, data-driven decisions on the 18th, to then create an order or a announcement news release to the general public so that business owners will then know how to react by the 22nd. So your time period of phase one would go past that meeting to give you ample time to communicate what those restrictions or regulations may look like.
so, Mr. Chairman, I would ask if the motion and second would accept an amendment to the date from May 18 to May 22nd.
Is this an amendment to the motion?
Mr. Chairman,
Well, if they would amend their own motion or something.
Mr. Chairman, this is Dave. In order to come to an agreement here and have our businesses rely on our decision, I'll willingly change the date from the 18th of May to
May 22nd.
May 22, but we, as Colleen suggested, on the 18th, when we convene as a county commission, we consider the Board of Health.
I think that's a given.
Yeah, and listen to see what the figures are then. I think we've said that until, last meeting I got an email that said the horse is dead, and I didn't quite understand what that was about, and so I called the person after the meeting. She said, "You guys beat that horse until it was dead," and I'm not ready to get another one of those emails, I'm afraid. So let's move this on. So I'm willing to change that motion.
If we change it to the 22nd, then we'll be out of compliance again with the state. But to move this along, I'll agree.
Yeah, and I think people need to understand we're out of sync with the state's dates, yeah.
I don't think that has a lot of bearing for Finney County right at the moment. This stage one in Finney County could last the rest of the month. But that's the decision we can make later on.
Right.
Right now, we have a motion, and I'm gonna call for the vote. All those in favor of the motion that we follow Governor Stage 1 until May 22nd. At that time, on May 18th, we will revisit this
Correct.
issue.
It's phase one.
Is that a fair summary of the motion?
Fair.
All those in favor say aye.
Aye.
Aye. Opposed?
Clifford votes nay.
It has been approved 4-1. I want to stress very much that I appreciate the health department's and Dr. Burns' opinion. We are not, personally do not discount that at all. I realize that this pandemic is serious and we're right in the middle of it. But as a commissioner, like I said earlier, there's many aspects to this, many sides. And I think the commission has spoken on behalf of the taxpayers who we represent as well. Very tough call, but this is on us. And I appreciate that. There's a lot of responsibility. I know on the two of you to put that call on you. We own this as a commissioner, this commission. So we're elected and maybe we won't be. So with that, I thank you, Dr. Burns. I really appreciate your efforts and God bless you. Hope your people continue this fantastic effort you're doing and stay the course.
I think Robert is.
Well, there'll be some follow-up that we'll need to do with Colleen as far as issuing an order and what that order will be. You'll need to get with your county counselor to do that. In essence, we'll be going into phase one. That should be formalized.
That's a good point.
So we'll need to be following up with that. And then that may require the chairman's signature as well, perhaps. And once again, it's agreement in essence here between the Board of Health and the county health officer to move forward into phase one. So we can identify that then directly within that order. And we'll get with county counselor to craft that.
I have a copy of the Seward County order if you're interested.
And Mr. Chairman, this is Dave speaking. I will offer a motion that we recess as a Board of Health and we reconvene as a Finney County Commission.
And I'm second that motion, Mrs. Long.
Been moved and seconded to adjourn Finney County Board of Health and rejoin the county commission. All those in favor say aye. Aye. Motion carried. We are now commissioners again.
I had one question, one point of information. The question is this. I know the bids were let for Jenny Barker Road a week ago, well, it'll be almost 2 weeks ago now. But I'm hearing from contractors that we should expect a much higher bid than what the estimates are. My question is this, do we know when the bid opening is for the Jenny Barker Road project?
I'm not aware of what the date is.
So would you just find out and just let us know when bid opening is? Because I'm getting very concerned that the project's going to be much higher, come in much higher than this. And then the other is just information. Did each of you commissioners receive, and even Robert, the communication from KAC about the letter that KAC sent to the governor on Tuesday with regard to property tax? Because the governor had asked KAC if KAC was in favor of extending the deadline for payment of property tax. And if the KAC said it was in favor of that, she would issue an order that it be extended. However, and in that communication, and those of you who didn't get it, I can forward it to you, but she's got, or not she, KAC has the table in there. And the county governments are recipients of less than 30% of the property tax. We've got townships, schools, municipal, university, airports, and there's a whole list that goes on to the second page of all the other taxing entities that would be affected by that. So KAC has chosen to remain neutral and not make a recommendation about extension because it affects so many other taxing agencies and they don't want to be speaking out of turn for those other agencies. So I just wanted to, and if you want me to forward that to you, just let me know and I'll forward it to you. But I thought it went to all the commissioners and to the administrator, but if not, I'll forward that to you because it's a well done letter and has a really good chart in it. And then lastly to that, yesterday we were we were asked if we're available next Wednesday or Thursday for a legislative policy committee meeting through KAC to discuss this and a couple of other issues that may take place when the legislature comes back, and it's coming back for a one-day session on May 21st. So Thank you, Mr. Chairman. That's my information. If you need that email, just let me know after the meeting and I'll forward it to you.
Good. I've received that. One last further comment, I guess this relates to our decision that, just for the public's knowledge, this stay-at-home order is still in effect through Sunday. What we discussed today does not take place till Monday, and subject to official publication that our county administrator has mentioned a little while ago. Okay, any further business from the commission? Adjourned.